for adults 65 and older remain effective in preventing disease, information based on studies suggests that vaccination is less effective at preventing infection and milder illness with symptoms. New evidence shows us also among healthcare workers and other frontline workers, vaccine effectiveness against COVID-19 infections is decreasing with time. Some groups more than others. This lower effectiveness is likely due to the combination of decreasing protection as time passes since getting the vaccination, what we call waning immunity, as well as the greater infectiousness of the new Delta variant. And based on trials, based on evidence, a booster shot has been shown to increase that immune response in those who finished their primary series 6 months ago. With this increased immune response, people who will have improved protection against COVID after the booster, including the Delta variant. Now, I think we all know the Pfizer booster has been approved about 3 weeks. Well, now the Moderna and J&J or Johnson & Johnson booster doses are approved. So who is eligible? It's confusing, and we hopefully will shed light on some of the confusion on who's eligible now. But basically, for individuals who received a Pfizer or Moderna vaccine, the following groups are eligible for a booster shot at 6 months or more after their primary series. First category, people aged 65 and older and residents of long-term care facilities, nursing homes. Second category, people age 18 and older who have an underlying medical condition, and we've all seen those lists, diabetes, heart disease, etc. The third category, people age 18 years and older who are at increased risk because of their job regularly exposes them to COVID-19 or in their living situation. Now, a completely separate category is for the Johnson & Johnson or J&J vaccine. For those immunized with that one dose, it's recommended that everybody receive a second dose of that vaccine at least 2 months after the first. So that's a special category for the J&J. Now, I'm not going to say much about mixing and matching vaccine. You may have questions about that, but my last comment is authorities suggest that for their booster, people stick with the vaccine they received initially, but they conceded and authorities conceded that some may need to mix and match because of preference or availability, and we can discuss that a little bit more later. So thank you for your opportunity, and I'll turn it over to Dr. Smith.
Thank you, Dr. McGahey, and thank you, George, for bringing us all here together. First, as a healthcare provider who takes care of sick children every day, I am very excited about the opportunity to receive my COVID-19 booster, as it has made me able to continue to do my job over the last year. And we know that this will be a really important tool to help keep our healthcare workforce at work safe and healthy. I want to talk a little bit today about children and COVID-19 and the vaccines that we anticipate coming soon for the 5 to 11-year-olds. Over the last 18 months, we have seen a tremendous toll taken on the lives of children across the country and in our community. There have been pieces of communication that have said that children don't get COVID or COVID-19 does not impact children, and we know that is simply not the case. We have seen over the past several months the number of children hospitalized with COVID-19 more than quadruple across the country, and we have seen in my own practice children need to be hospitalized. In addition, just in the state of Texas, 14,000 children have lost a primary caregiver to COVID-19. So the tolls that COVID-19 has taken on our children are both physical and emotional, and really will impact them for a lifetime to come. I encourage, as Dr. McGahey did, all eligible adolescents who are 12 and up to get vaccinated now if you're not already vaccinated. These vaccines are safe, they are effective, and they are very good at reducing the likelihood of being hospitalized or having permanent disabilities related to COVID-19. In addition, in the next few weeks, we anticipate being able to vaccinate 5 to 11-year-olds. There are 28 million 5 to 11-year-olds in the United States. According to the most recent data by the American Academy of Pediatrics, 6 million of those children have had COVID-19, including 1 million in the last 6 weeks alone. So we know that we are seeing increased case numbers among our young children. We know that it is critical for children to be able to be in school safely and to stay in school for them to be able to develop and thrive. And being able to vaccinate children who are 5 to 11 is one of the most effective ways we will have to allow them to continue and to resume a normal life. I also want to speak as a mom. Anytime we do something new, anytime there is a new therapy or a new vaccine, there are lots of questions. I encourage you to reach out to your local pediatricians. We have been researching and learning and paying attention to all of this data, and we know that the number of children who have been enrolled in the studies gives us confidence in the safety of these vaccines, and that the millions of adolescents that we've seen who've been vaccinated also gives us confidence in these vaccines. So my children, I'm fortunate, my children are all teenagers. I don't know if that makes me fortunate or not, some days actually, but my children are all teenagers, and so they were eligible for vaccination. And I can attest, when we were back in Hervey Hall, I was there the first Saturday after vaccination with my kids to get them vaccinated, because it has allowed my oldest to go off to college with confidence that she is protected from severe illness, and it's allowed my children to return to school. And so I just encourage those parents in our community to reach out to the people who they have trusted to make health decisions with them for their children for as long as their children have been alive, to help guide them through this process. One of the exciting things about the Pfizer vaccine for younger children is that it is able to be stored for longer periods of time in regular vaccine refrigerators, which means that it will be accessible to pediatric offices. So we really are encouraging all of our pediatric clinics in the area to be ready to accept that vaccination and begin vaccinating their children. Thank you.
Thank you. I'm Dr. Mark Anderson. I'm the Chief Medical Officer for Christus Mother Francis here in Tyler. I want to talk a little bit about what we've experienced at Christus Health and all the associates have experienced. Honestly, this latest surge due to the Delta variant has been a tragedy for many communities and families. We've received transfers not just from facilities here in Tyler and Smith County, but from across the region, and had a need to double our ICU capacity in order to meet that need. It's very unfortunate that over the last couple of months, we've seen over 250 deaths at our facility alone from COVID-19. We know some numbers, though. We know some facts around this. Number one, 90% of patients admitted to the hospital for COVID-19 are unvaccinated. Nearly everyone that died in our facility from COVID-19 is unvaccinated. There are a number of things people can do to predict this. Many people know they have comorbidities. Those things around obesity and diabetes and heart disease, cancer, kidney disease, all these things make you at risk for developing a serious case of COVID-19 that could require hospitalization or potentially put you at risk for dying from COVID-19. There's a solution for that. It's vaccination. If you know you're at risk, you need to get vaccinated. If you know you're at risk and you've been vaccinated, a booster is indicated right now to help you with that immune status in order to be able to fight vaccine and not end up in the hospital. We're very fortunate. The numbers have dropped here recently. We're getting through this surge. We're all thankful for it, but we certainly don't want to see another one. We are at risk for that due to the low rates of vaccination in our communities, and we don't know what natural immunity is out there. So please get vaccinated. If you're at risk, in particular, get a booster. Please ensure your children, as this becomes available for children. We have children that are at risk, as you've heard, children that have obesity and diabetes and cancer and other things that absolutely need to be treated so we don't see an increase in deaths from COVID-19. We're all looking forward to the ability to offer the vaccine. Our facilities remain safe places to receive care. Throughout this surge, we've been able to maintain urgent surgeries, stroke care, cardiac care, cancer care, everything we need to do to support our communities. But it definitely is a tragedy and one that potentially is prevented if people get vaccinated appropriately. So, thank you.
Thank you, George. Good morning. Dr. Steve Cox for UT Health East Texas, and I appreciate the opportunity to speak today. And I really want to say that throughout this pandemic, we're very optimistic about the future. We've seen tremendous suffering for patients and their families with COVID-19, and we're very optimistic. We made remarkable progress over the past 2 years. This progress really for the health system could not have been possible without the efforts of every member of the community. We've seen this remarkable collaboration between state and local government, Net Health, local faith communities, as well as our frontline healthcare workers. I think it's important that we recognize our frontline healthcare workers, particularly our nurses, our doctors, who continue to work tirelessly every day to provide the best quality care for our patients. And we should also recognize some of those who are not recognized frequently, our laboratory workers who run countless thousands of COVID-19 tests in our communities, and as well as our many community volunteers. We've made great progress in the pandemic, but we have a great deal of work to do. And the best way out of the pandemic is to continue to work together as a community and continue to focus on vaccination. So a quick update related to UT Health East Texas and our status there. Hospitalizations, you know, are down currently, which is good news. In the last month, we did see our largest peak in the pandemic with as many as 300 patients in the hospital in our 10-hospital system at any one given day, and as many as 90 patients in our hospital system on ventilators. So we have seen a decrease, thankfully. And today and this past week, we're seeing less than 50 patients currently admitted to our hospital system and less than 20 patients on ventilators. So great news. I think we're making great progress even with the Delta variant, and most of that progress has been made due to vaccination. And as Dr. Anderson indicated, a vast majority of those patients who are hospitalized today across our division are those who are unvaccinated, and those patients have the highest risk. Most of those deaths, the vast majority of those deaths, are in those patients who are unvaccinated. It's very important that we do not get lulled into a false sense of security in the fact that today the numbers are much lower, because we still have a very large proportion of the population who remains unvaccinated today. And the thing that I try to tell my patients in the clinic is that there was a lot of fear and anxiety early on in the pandemic. There appears to be less now, but to the unvaccinated individual, the risk of severe illness and the risk of death today is just as great as it was a year ago or at the beginning of the pandemic. The disease has not changed in terms of its severity of illness, in terms of outcomes. The Delta variant certainly makes the disease more contagious, more highly transmissible, but the risk of death and severe illness, particularly those, as Dr. Anderson mentioned, with multiple medical conditions, comorbidities we call it, they're at significantly higher risk. So the important thing for us to do today is to not drop our guard and to continue to focus on vaccination. And then finally, as we enter the holiday season, we all do want to spend time with our families, with our friends, and with our loved ones. The most important thing we can do to protect ourselves, to protect others, and protect our community is to focus on vaccination. And remember the simple things: to stay at home if you're sick, to wash your hands frequently, to wear a mask in public, particularly if you're in areas of high transmission, and then to get tested if you've been around someone with COVID-19, and particularly if you have any symptoms. And again, while the numbers are down, we are not out of the woods yet, but I believe that the right path forward is vaccination, and the light that shows us that path through the woods is the light of understanding and knowledge about the safety and the effectiveness of the vaccine. Thank you very much.
Good morning. Thank you all for being here. Thank you, George, for this opportunity. Thank you all the doctors for all this great information that you provided us with this morning. It clears up, it makes things a little bit clearer, because there's a lot of people that are very confused out there. I'm Ed Thompson. I'm the owner and operator of the Majesty Event Center, and it's just such an honor to be able to host and work with and partner with, Tyler HealthNet to do this vaccine, clinic. It is so needed, and it's so convenient for so many people, that's in Tyler. A lot of people coming in from Lindale and different areas say it's very easy for them to find. And so it's been a great honor, and the staff of, Net Health has been great to work with. This facility was designed to be able to make a difference in Tyler. Different in a lot of ways with a lot of people, as far as their weddings, events, but most of all, health fairs, stuff like this, for as the vaccination clinic is also, designated to be a FEMA shelter, if need be, if we have like a tornado that hit like in Van 3-4 years ago. So the Majesty Event Center will have its doors open. We'll work with Net Health as long as needed to get this deadly virus under control, because it's bad, and a lot of people are not taking it as serious as they should. And it touched very personal with me. I just got my booster shot this morning, but I plead to all my Texans out there, all of my Tyler citizens, neighbors, please, please get vaccinated if you're not vaccinated. Last weekend, I had 5 family members to pass away, 5 funerals in one weekend. And I had an aunt, and that was very dear to me, that was like a mom. And so I wish that for no one, But the only way that we're going to ever get this virus under control and get rid of it, and it's going to take everyone fighting together. So please get your vaccination. The Net Health has everything here. They have the boosters, they have Pfizer, they have Moderna, they have all the medicine you need for the vaccination. So, come, they taking walk-ins, you're welcome. No one is being turned away. So we're going to be there when the kids, we're going to do some special stuff with Net Health for the kids when it's time for them to get vaccinated. So I just want to thank Net Health again. George, thank you very much. Thank all you doctors for clearing up and update on where the vaccine is at this current time. Thank the media for being here, and you're always welcome at the Majesty Event Center.
Thank you for sharing your information there. Appreciate you sharing. I'm sorry for your personal loss that you've experienced during this time. Also want to thank Dr. McGahey, Dr. Smith, Dr. Anderson, Dr. Cox for being here and sharing their information. So right now is our Q&A portion. So myself and my team over here is ready to answer your questions. So who would like to start?
Sure, I'll start. George, I know it was mentioned in the press conference about the possible approval for 5 to 11 kids getting the vaccine. I know the advisory committee meets tomorrow. Are you guys preparing now to get those vaccines into the arms of children once that approval comes?
Sure, yes, we are preparing for that, Blake, and we've ordered the vaccine. It's going to be a little different. I'll have Dr. McGahey and Dr. Smith tell you a little bit about what's the difference in the 5 to 11 vaccine versus the other. But we are preparing for that. Mr. Thompson even mentioned that we're going to be offering those shots right here at the Majesty Event Center as soon as we are authorized to do that. So yes, we are making preparations now. We have ordered the new medicine that comes along with that, new Pfizer vaccine. So yes, we are prepared. And Dr. McGahey, Dr. Smith, you want to say something about this?
I would just add that, yes, so the vaccine for 5 to 11-year-olds is half the dose of the vaccine for 12 and up, so they will be coming as completely separately packaged vials. It's not like you can go someplace that's been giving adult vaccines and just be like, give them half a dose, right, of this vaccine. So you do want to make sure as you take your 5 to 11-year-old that you take them somewhere that does have pediatric vaccine supply. As I mentioned earlier, that vaccine supply will be able to be kept in normal vaccine refrigerators for up to 10 weeks as opposed to 4 for our adult vaccine currently, which should make it much more accessible for small clinics like myself and pediatric clinics across our region to be able to provide it there in their clinics, as well as places like the Majesty Event Center. I don't know if you have any other specific questions around children.
For parents, listening to this, as far as, when adults got the shot, Pfizer had a 2-shot vaccine, Moderna had a 2-shot vaccine. With the one from 5 to 11, is it just 1 shot?
No, still 2 doses, but just half the dose each time. So kids are amazing. It's one of the reasons I'm a pediatrician, right? So one of the things we know is that their immune systems are designed uniquely to be taking in antigens, things they're exposed to all day long, and filtering out what's good, bad, you know, what do I need to mount an immune response to. So because of that, they don't need as high of a dose as older adults and older teenagers do, because their immune systems are primed and, you know, and ready to receive this, but they still will need to get 2 doses.
What's the recommended time length between shot 1 and shot 2?
Still 3 weeks? 21 days. Yeah. Thanks.
Okay.
Next up? No questions here? Yes, ma'am. Sorry. Sure, about the vaccinated and unvaccinated. So I'm going to let Dr. Anderson and both Dr. Anderson and Dr. Cox answer that question. So we'll.
Well, thank you. I think our numbers are largely the same, that 90% of patients that are admitted to the hospital into our COVID units with COVID-19 are unvaccinated. And almost all the deaths we've experienced are in the unvaccinated population. Similar numbers, we had 90 patients, COVID patients, at our peak on ventilators. And typically, once you're in the ICU, nearly half of those patients die. They don't survive it. And again, those are unvaccinated patients we're seeing.
Yeah, and we're seeing the same across UT Health Texas. More than 90% of those patients in the hospital and the ICU are the unvaccinated patients. And really those even who do succumb to the illness are those who have typically multiple comorbid conditions. Those with diabetes, heart disease, COPD, hypertension, and then even just being overweight and obese is a very strong risk factor. But yeah, certainly a vast majority are unvaccinated currently.
You know, in our spring surge, and with the initial release of the vaccine, we vaccinated a lot of patients that were over 65 years old. With this surge, we saw deaths in much younger age, including young adults in that 19 to 25-year age with comorbidities. We saw patients die at that age group too as well. So this has been very devastating, as I mentioned, for families.
Absolutely, and that's certainly true across our health system and really across the country. The demographic has completely changed. We're seeing patients in their 20s, 30s, 40s, and 50s who are critically ill with COVID-19. And so it's very important that the younger people continue to look toward and get vaccinated.
Okay. Thank you.
Yep.
Other questions?
George, I know early on when we had vaccines for older kids, you guys partnered up with some school districts and offered some clinics pending approval for 5 to 11. Will you guys be doing similar things with school districts?
Yeah, we've continued. We've had a pretty strong outreach, really going back to earlier in the year, and continue that process.
I'm curious, do you already have the specific supply in, so when the approval comes, you can immediately start administering those?
I don't know if we had the Russell, or I'm gonna look at. I don't think we have the supply in of the 5 to 11 group yet. I think we ordered it last week, or so I don't think we have it in quite yet.
Okay, but you've ordered it.
Yeah, we've ordered it, and again, the approvals should happen on that. We think sometime middle part of next week is what we're anticipating. Other questions? All right, again, I want to thank you all for coming out here today and hearing about this. The main message today is to get vaccinated. We've got booster shots are available, so please talk to your provider. If you're concerned about that, talk to your provider about whether you should get a booster or not. Come see us here at Net Health for your booster, your local pharmacies, your private practice clinicians. But the main thing is get vaccinated for your boosters, but also get vaccinated if you're still on the fence about your first or second dose of one of the vaccines. You've heard from the folks from the hospital today, Dr. Cox and Dr. Anderson, both said the people in their hospital, 90+% of the people in their hospital being treated for COVID are unvaccinated. So please consider getting vaccinated today, and we look forward to continuing to serve you. More information about any of our topics, about vaccination locations, about just general information about COVID, statistics, etc. Go to nethealthcovid19.org for that information. Any further questions?
George, before you conclude.
Yes, sir.
You might want to let them know that individuals that had their first and second dose, if they lost their card, that y'all have all that information in it.
Yeah, good. Thank you, Ed. So if you've lost your card, we can look that information up for you, and we can, if you've had the information, we can look in the M-Track system for that information, the state system, and we can find that information for you. So don't let that be a deterrent for you getting your either first, second dose, or even your booster shot. So thank you, Ed, for that. Thank you for bringing that up. Again, thank you all for being here today. Thank you, Dr. McGahey, Dr. Smith, Dr. Anderson, Dr. Cox, and Mr. Thompson for being here today. And y'all have a great day. Thank you very much. Stay safe out there.